Hi and welcome to our telehealth video information service. My name is Garvin and this video is on Vagi Fem pessaries. So what is Vagi Fem used for? It's used for relieving vaginal symptoms of menopause such as dryness, itching or irritation. How does Vagi Fem work? So Vagifem Vaginal tablets or pessaries contain the active ingredient estradiol, hemihydrate, which is a naturally occurring form of the main female sex hormone, estrogen. And women's ovaries gradually produce less and less estrogen in the period up to the menopause, and estrogen blood levels decline as a result. The declining levels of estrogen can cause distressing symptoms and often affect the delicate lining of the vagina. Estrogen deficiency can cause vaginal dryness, inflammation or itching, and this in turn can lead to sex being uncomfortable or painful and to an increased susceptibility to vaginal or urinary infections. Estrogen can be given as a supplement to replace the falling levels in the body and help reduce the distressing symptoms of the menopause. This is known as hormone replacement therapy, or HRT. Estrogen, in this case, in the form of estradiol, can also be inserted directly into the vagina in the form of vaginal tablets in order to directly supplement the vaginal tissues with estrogen. This is known as topical HRT and is useful for relieving just the vaginal symptoms of the menopause. Vagifem Vaginal tablets release small amounts of estrogen locally into the vaginal tissues and are used short-term to provide relief from the vaginal symptoms of menopause such as dryness, itching and irritation. Estradiol from Vagifem is only absorbed from the vagina into the bloodstream to a very small extent. However, as it may potentially be associated with the same risks as other forms of HRT, it carries the same warnings. These warnings are most relevant to repeated or long-term use of the vaginal tablets. You can read more about the risks and benefits of HRT on my website under menopause. To minimize the absorption of this medicine, the lowest dose to control symptoms should be used and treatment should be stopped about every 3 months to see if it is still needed. So how do you use Vagifem pessaries? First of all, you follow the instructions provided with your Vagifem tablets carefully. The tablets or pessaries should be inserted into the vagina using the applicator provided. They should not be taken by mouth. One vaginal pessary should be inserted into the vagina once a day for the first 2 weeks. After this, you should insert one tablet or pessary twice a week, every 3 or 4 days. If you forget to insert a tablet, insert it as soon as you remember, unless it is nearly time for your next dose. And in this case, just leave out the missed dose and insert the next tablet as usual when it's due. Do not insert 2 tablets to make up for an earlier missed dose. Vagifem should not be used by women with known or suspected or a past history of breast cancer, and women with known or a suspected cancer in which growth of the cancer is stimulated by estrogen. For example, cancer in the lining of the womb, which is endometrial cancer. Women with untreated overgrowth of the lining of the womb should all not to be used by those. And also for women with vaginal bleeding, where the cause is not known. And also for women with blood disorders that increase the risk of blood clots in the veins. And women with a blood clot in the vein of the leg, which is deep vein thrombosis, or in the lungs. And women with inflammation of the vein caused by a blood clot. And women who have recently had a stroke caused by a blood clot. And women who have recently had a heart attack. So next is pregnancy and breastfeeding. This medicine should not be used by women who are pregnant or breastfeeding. You should stop using this medicine and consult your doctor immediately if you get pregnant during treatment. So the possible side effects of Vagifem pessaries. Common side effects include vaginal bleeding, vaginal discharge, vaginal discomfort, headache and abdominal pain. Uncommon side effects include feeling sick, a skin rash, weight gain, and rise in blood pressure, fungal infection in the vagina such as thrush. How can Vagifem affect other medicines? The estradiol from Vagifem tablets is only absorbed into the bloodstream in low amounts, so is less likely than other forms of HRT to interact significantly with other medicines that you're taking, for example by mouth or injection. If you need to use any other vaginal medicines, for example pessaries or creams for thrush or other infections, your doctor may want you to stop using Vagifem during the treatment. Always check with your doctor first if you have any questions. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas and Cork, or you can ring us at 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.